We continue our new series called Working Past COVID, What's the New Normal? We've heard the stories of hard work and heroism inside of our hospitals, nurses and doctors working tirelessly to treat COVID-19 patients. I met with a nurse from Cadillac Regional Medical Center and their chief executive who share what it's really been like working on the front line. Let's go back to March 2020. People in the United States are becoming ill, and hospitals nationwide are preparing for the unknown.
We designated the COVID units. We started the training.
It's initially just trying to gather as much information as you can.
Lead nurse Jennifer Van Dyken works with the sickest patients on Cadillac's acute floor. She says as they prepared, staff couldn't help but feel afraid.
We went through the gamut of emotions, being afraid of what it was, being afraid of coming to work, being afraid of taking it home or into our community.
Still, workers persevered against a virus that didn't fit the mold.
They weren't all the same. They didn't present the same. They didn't heal the same. We were, really on alert for any symptom.
Cadillac's chief executive Riza Khalil says they do have emergency plans and staff know how to handle infectious disease patients. But the pandemic has been different.
Again, we're used to doing, but not on this large of a scale. So it was to some extent scaling infectious disease practices across the whole organization.
Khalil says it's been important to disseminate correct information, normalize new practices, and keep staff healthy.
Programs for mental health and support that they have access to, and then financial support early on when we didn't know, where things were going and people were affected in different ways.
While many patients were sent home to recover, Van Dyken says there was death, exacerbated by pandemic protocol.
People did die alone, and that was tough. It was emotionally tough. I still don't know how we would deal with it. It's just something that we had to do.
Both Jennifer and Riza say they're extremely proud of the hard work from their coworkers.
There's a certain amount of grit and sacrifice that I can't thank our staff enough for.
There is a light at the end of the tunnel.
And when questioned if they think we'll return to normal, this was the nurse's answer.
A new normal. I think we'll forever be changed.